We'll give it another minute or two. Thank you everyone for coming. My name is Susan Foster. I'm at the Center for Independent Living of Northwest Florida. We have today Keeley Washel from QMedic, who's here to present to us all about the devices that she has. Thank you so much. Cherie would like to know, could you put your information into the chat?
Absolutely.
Okay. Thank you for being here, all of you. With the Center for Independent Living, we serve 4 counties. That's Escambia, Santa Rosa, Okaloosa, and Walton. Here's Keeley. Thank you for being here, Keeley. You're welcome to start your presentation.
Okay. Wonderful. Well, good afternoon, everyone. And thank you so much for the opportunity to speak with you all today. My name is Keeley Washel, and I am QMedic's Southeastern Territory Manager. As QMedic has worked to make our services more accessible to members across the country, I am excited to share with you all today about QMedic and what makes us a little different compared to some of the emergency response systems, medical alerts, or PERS, as many refer to them, that you might be more familiar with. And if at any point you have any questions during the presentation, if you wouldn't mind holding them till the end, I would be more than happy to answer them. So a little background on QMedic. We are what we like to call a proactive PERS, which I will get into in detail throughout the presentation today. We were founded in 2010 by a group of MIT graduates who, in partnering with several leading research institutions like the National Institute of Health and our friends down at the University of Florida Institute on Aging, we were able to partner and create a means of monitoring that home and community-based service population in a way that really works to promote preventative care. So this was certainly something that was very personal to many of our founders, as they had seen a need for a service like this, not only in their own families, but in their communities as well. And their ultimate goal in creating this product, which is still our main mission and goal today, is to maximize individuals' independence while still maintaining the highest quality of life and safety for all of our members. So what I find really sets us apart is the fact that we do offer just so many different options to meet the needs of a very diverse population of individuals. So QMedic, we really do try to have something for everyone, as we know that no 2 individuals have exactly the same needs. So we do offer in-home devices, we have mobile devices, we offer units with fall detection, GPS devices that can be tracked in real time through a caregiver app or text message alerts. Something that we actually just started to roll out this year is a smartwatch mobile unit. It's really something we're using as a special case situation, maybe individuals who are more tech savvy, maybe younger members, It is a little bit more complex than our ultra simple traditional units, but for members who, they might not feel comfortable wearing that stereotypical looking medical alert, but are still really in need of the service, it is an excellent option. Our devices, they are intentionally very simple so that they can be used by anyone regardless of ability level. I know a question we often get is, my loved one or my client, they don't have access to a phone. Can they still use this system? The answer is absolutely yes. They do not need a phone. They do not need Wi-Fi, any sort of adapter to use our units. Our PERS, they actually function as their own cellular device. Our units also don't require installation or an installation fee, simply because of how easy they are to set up. If you can plug in a toaster, you can install our unit. With that being said, if we have a member that feels that they would benefit from having someone else come and set up the unit, go over how to use it exactly, we can certainly arrange for that as well. We also have a call center that handles every call that comes in very differently and very specifically. I know what we have found over the years is that a lot of times these individuals, when they press those help buttons, they might actually not necessarily need 911. They might need something a little bit different, maybe a little more person-centric. So we do try to give that option to not only cut down on false alarms, but to really limit any unnecessary emergency room runs as well. I personally have a background working as a case manager in home and community-based services and IDD case management. And so I know from my own experience, false alarms, unnecessary trips to an emergency room, that can be incredibly traumatic and very upsetting to several individuals. And the data that we've collected, it does suggest that individuals who have experienced an event like a false alarm or an unnecessary ER run, they're more likely to stop wearing these medical alert devices. So our goal at QMedic is to make it simple for our members to want to keep wearing these devices, because once they come off, they're no longer protected. It's not doing anyone any good. We also utilize a dashboard to monitor our members. So depending on which type of unit the member selects, either the in-home or the mobile, we can see anything from their wear compliance, their activity levels, sleep patterns, GPS location, the battery level in the unit, and of course, anytime that member presses their button. We are actually able to provide care teams and caregivers with access to all of that proactive monitoring information as well through a portal. We utilize different cellular providers as well to try to service as many individuals as possible. So in terms of covering a member who might live in an area with weak cell service, we are compatible with several different carriers, including Verizon, AT&T, and most recently, US Cellular. If a member has no cell service at all, we also do have in-home units that are compatible to be hooked up with a landline. So for members where the landline's the only option, we can provide services to them as well. To dive deeper into those unit options, like I said, we do offer both an in-home version and a mobile device. They are designed a little differently and they do have some different capabilities. So on the left, this is our proprietary device, our in-home unit. It comes with a base station that needs to stay connected into power, and then a wearable pendant that the member will wear on their person. So upon setup, we do give the option to choose between either a bracelet or a necklace wearable. And we make it easy so that a member can opt to swap between the two options at any time free of charge. This unit, it has a wearable to base station range of about 1,000 feet, which I will say, knowing the industry, that is huge. The closest any other provider comes to that range is about 400 to 500 feet. So we are nearly double that industry standard. We've seen our units be successful in picking up someone's help call either out at their mailbox or even in their backyard, just dependent upon where that base station is placed in their home. Our wearables, they have a 2-year battery life, so they never need to be charged. And we monitor these battery levels in the wearables daily, and we reach out to the member to replace before the wearables ever completely run out of charge. And this is our unit where we're able to monitor those health levels. So the wear compliance, activity levels, sleep patterns, and button presses, those are all calculated through sensors in that wearable that the member is wearing on their person. The data from the wearables is then transmitted to our monitoring dashboard. And like I said, it can be made available either to the individual's care team, so their care managers, their health plan, or their caregivers and loved ones as requested. On the right is our mobile device. It does come on a necklace lanyard, but we do provide a belt clip for people who prefer to wear it that way. Maybe they want to wear it on the collar of their shirt, on a pocketbook. The unit itself, we get a lot of questions about the weight, just because some people find it uncomfortable to have something heavy around their neck. The best comparison I've come up with, it's about the size and weight of a full pack of Tic Tac mints. I know that's a strange comparison, but most people are familiar with that. And I feel like it's pretty accurate. So this unit, it is a great option for individuals who they're either active in their community or often on the go. Maybe they spend time visiting out of town relatives and still want that security of being able to call for help when they need it. The member, they actually communicate directly through the unit, so they don't need to worry about staying in range of a base station or carrying around a transmitter. These units, they do require a 3-hour charge once a month, and we do provide a charging cradle. The mobile units, they're water resistant due to the speaker being built directly into the unit, as you can see in that picture. They do need to be removed while bathing. They can't be fully submerged in water. And with the mobile devices, we do offer option add-ons. Our members can opt into fall detection and on-demand location tracking at no additional charge. I will say though, with the addition of these options, it can decrease that battery life. So members, they can need to charge their device anywhere from once a week to once a day, just really dependent on the cellular coverage in their area. Something else really unique about the QMedic system is our option for intelligent routing. So I know I touched upon this earlier, but we do offer individuals the option to choose how that button press is routed. Those who might need help, but maybe not necessarily an ambulance, if they're able to, they can tell the call center operator if they just prefer to have an emergency contact called, or maybe if their health plan offers it, they can call to speak to a nurse triage. In our call center accounts, which we create all of this information upon setup, we can provide notes to the operators to relay on to the responding emergency services team with information specific to the member. So anything that the member would want EMS to know upon their arrival. Maybe they want to indicate their medical history, current medication list, or even the appropriate way to communicate with that member. Our operators can make that information available to the first responders. This is probably not surprising, but we have certainly seen an increase in members utilizing this intelligent routing capability throughout the course of the pandemic. A lot of people have been trying to avoid any unnecessary trips to the emergency room during the height of COVID. And this has certainly also been a useful tool for our members who might not have access to a phone to get in touch with either a family member or emergency contact for non-emergency situations. I know in several of the territories we cover, we saw some pretty nasty winter weather this year. I know you folks in Florida have some wonderful weather, but you do deal with the hurricanes. But many of these members, we saw they were without power for several days. At that point, maybe their cell phone had run out of battery and they didn't have another means of communication. Several of our members, they were able to get in touch with an emergency contact, either to let them know that they were okay, or maybe that they needed something through our medical alert devices. And actually specific to our Florida members, we've developed what we call our Hurricane Initiative. So we have really seen this utilized more on a larger scale with the managed care plans that we partner with, but it's certainly also been successful on smaller scales with caregivers and emergency contacts. So on the day before landfall of a major hurricane, we do activate our power outage report for all of our Florida members. So either then the individual's health plan or their emergency contact will receive notification within 20 minutes of the member losing power. And that report, it's sent multiple times a day to these health plans, and we continue to communicate when we detect any additional power outages. After that report goes out, we do work to coordinate with our members and emergency care contacts with instructions on how to restore power to that unit. And really, not only is it important to get those members' medical alert systems up and running, we have several members that are technology dependent, and it's been successful in making sure that those systems are up and running as well. It's really very imperative to their safety. So as you can see here, that is a pretty staggering statistic that 71% of emergency room visits are avoidable or unnecessary. And really, we work so that our intelligent routing capabilities are able to help ensure that our members are receiving the help most appropriate for their condition and most appropriate for their unique needs. Here you can see what our dashboard looks like. I do apologize. I know it's a little hard to see on this slide, but there's a blue rooster that indicates when the member gets up for the day. And then there's black lines indicating when the member lays down to go to bed at night. Those other colorful lines you see there, they represent different wellness indicators. So those activity levels, sleep patterns, the wear compliance. When we first set up a member with our services, we take a 30-day baseline monitoring of their activity levels and sleep compliance. And then if we notice any inconsistencies after that baseline 30 days, we reach out to the member with our on-call social workers to make sure that our members are okay. If they do need something or we have concerns, we reach out to emergency contacts, care teams, health plans if needed as well. I will be honest, I find the previous slide to be a little confusing. That dashboard, I'm certainly no data scientist, but what we do, we offer a caregiver option where we really condense all that information from the previous slide down into what you really care about knowing. So for loved ones and care managers, we have our dashboard here that indicates whether the user is wearing their unit correctly and whether they've hit their wellness goals for the day. What we pride ourselves on, and what I will tell you is my biggest push, just because of my own background, is keeping that open line of communication open with members' care teams, with their loved ones, and with our partner health plans. We really do work to try to make sure that you are as informed as possible in regard to your consumer or your loved one. And we do keep in touch, like I said, with any important member updates. So again, if we notice something off on their dashboard data, we alert designated care contacts anytime the member experiences an emergency. And our support team, they are wonderful. If anything's reported to us, say a member reports that they've lost their device or they need a replacement charging cradle, what have you, we reach out to those members immediately to coordinate those replacements just as soon as we are notified. Another unique way we're able to support our care teams and caregivers is through our direct dial capabilities. For members who are utilizing our in-home units, either their care managers or their caregivers, they can have the ability to request either that a member direct dial them through the unit by providing their phone number, or alternatively, they do have the option to just dial through the device and reach the member that way. We've definitely seen success with this, helping care managers and caregivers really get in touch with those harder to reach members. We saw this become a popular means of more frequent non-contact communication with members during the height of the pandemic. You can also connect with multiple parties. So you can dial in with family members, doctors, case managers, police. We've seen care conferences held over these in-home devices. We've even helped our partner health plans and local community agencies communicate COVID vaccine information over these devices as well. So really, the possibilities and creative ways we can use these units, it's really endless. And I will tell you that many of the implementations that we've made are based off of suggestions from our members, our caregivers, our partner organizations. You're the ones who are utilizing these services, and we want to make sure that they're meeting all of your needs. So we really are unique in the fact that this is our own technology, and we can make those tweaks based upon what we're seeing from our communities. Here's a comparison chart of sorts, shows what features are offered by several of the PERS industry leaders. You might be familiar with some of these other companies, maybe you've seen them on TV. This is certainly in no way intended to rate one provider over another. At QMedic, we do just try to educate on what features are available and what is out there. I know when I was working in the case management field, I had this idea that medical alert was kind of a one-size-fits-all kind of service, which really is not true. And what works for one member, what feature might benefit them, maybe isn't so important to another. So we do just try to make members aware of exactly what they should be expecting from their providers. So as you can see in regard to QMedic, where we try to shine is that proactive monitoring, our ability to calculate that activity levels, sleep and wear compliance. We do offer that power outage detection, wearable device range, the direct dial, and then we do also offer a free lockbox. I do just want to briefly touch upon the lockbox because I am embarrassed to admit I didn't fully understand the point in these lockboxes before coming on board with QMedic. But I will say what they are intended to do, you can store keys to the member's home inside of these lockboxes. The members, they can create a passcode, which they provide to us to relay on to emergency services to avoid any forced entry into the home. I know something that really gets overlooked is that when you do call for help, if emergency services are unable to enter your home to assess, they're breaking in. So this is just something that we offer to improve the member's overall experience, offer some additional peace of mind. So just to reiterate, we really do try to make our units and the process of working with us as simple as possible. We really are a smaller company, and we do have a wonderful support staff who really value feedback, not only from the members, but from caregivers and care managers as well. And we are just working towards creating the best experience as possible for our members. Again, members don't need a phone. That's a huge question that we receive. No phone, no Wi-Fi. These are completely independent of any means of communication. If there's any questions, I would love to answer them in the chat box. Please feel free. Certainly. So there's a question about cost. Right now, we do offer a yearly plan. Our in-home unit is $300 annually, and our mobile device is $400 annually. We are partnered with several of the managed care organizations, and our units are covered under that long-term care benefit. So we do have situations like this currently on family plans. If a family opts in to our in-home unit, we can provide more than one of those wearable help buttons, and then it would just be the cost of that base station. So it would be just one single account, and then we would add any additional family members on as partners to that one account.
Keeley,
Yes.
do any of the insurances cover this?
Yes. So currently Sunshine Health and WellCare both covered this device completely under the long-term care benefit.
Great.
Oh, I understand. We don't have anything like that currently, but we are always open to discussing options such as that. We can work with our billing manager for situations. You're welcome.
Well, if there's no more questions, Keeley, thank you so much for joining us today.
Thank you for having me. I really appreciate it.
Great presentation. I was just very pleased with it. Thank you all for joining us also. I hope you all have a wonderful week. Watch out for the hurricane that may be coming. We've got one out there in the Gulf that's stirring up a storm. So I appreciate you being here, Kaylin. Thank you so much.
Thank you all, and you stay safe. Thank you very much.
All right. Bye-bye.